beautiful hands, comfortable feet, strong joints. With this vision, W Hospital began its journey as the very first hospital in Daegu dedicated to hand surgery. Since then, we have led the way in treating hand and musculoskeletal disorders not only for our local community, but for patients across Korea. Founded in September 2008 in Daegu with 163 beds and 5 operating rooms, W Hospital quickly became a certified training center of the Korean Society for Surgery of the Hand. It soon became recognized nationwide as the most trusted name in hand surgery. Surgeons from across Korea and abroad came here to refine their skills and master advanced techniques. In 2011, W Hospital was designated by the Ministry of Health and Welfare as a specialized hospital for microsurgical replantation. That same year, we made medical history with Korea's first successful 3-toe transfer for a patient who had lost all 5 fingers, an achievement that drew nationwide media attention. W Hospital, having earned nationwide recognition, faced an overflow of patients. To achieve its second leap as a specialized orthopedic and joint hospital, construction of a new building began in 2013 on the main site. In 2015, we opened a new 261-bed main building, covering 11,385 square meters, to meet the needs of more patients and to strengthen our role as a national leader. In recognition of his contributions to hand and microsurgery, President Sang Hyun-woo was simultaneously appointed as President of the Korean Society for Surgery of the Hand and President of the Korean Society for Microsurgery. In February 2017, W Hospital once again rewrote medical history by performing Korea's first successful arm allotransplant. Later that year, the patient threw the ceremonial first pitch at a professional baseball game, bringing new hope to amputees across the nation. This groundbreaking surgery not only advanced reconstructive transplantation, but also reshaped Korea's organ transplantation laws and insurance policies. By 2017, W Hospital stood alone in the Yeongnam region as the only hospital officially designated for both joint specialty and microsurgical replantation. In 2018, we were elevated to general hospital status. Through relentless dedication to safety and quality, W Hospital achieved 4 consecutive national accreditations as a certified medical institution. In 2023, we further enhanced patient care with the launch of integrated nursing services. By December 2022, outpatient visits had already surpassed 400,000. Building on that momentum, W Hospital in 2024 cared for nearly 300,000 outpatients and 15,000 inpatients, and performed more than 20,000 surgeries with a daily average of 931 outpatients, 287 inpatients, and 71 operations, and a 97% bed occupancy rate. As Korea's leader in hand surgery and orthopedic care, W Hospital performs the nation's highest volume of major hand operations, as well as a wide range of orthopedic procedures, including artificial joint replacement. As a designated regional emergency medical institution, W Hospital provided care to 19,239 emergency trauma patients in 2024, fully living up to its mission. This solidified our status not only as the leading hospital of the region, but as a national leader in microsurgical replantation and orthopedic care. In September 2024, we further strengthened diagnostic services with the opening of our third MRI suite. In June 2022, W Hospital began a bold new chapter by breaking ground on a 15-story expansion, with 2 underground levels and a total floor area of 11,612 square meters. In October 2024, we proudly opened this new wing, marking a major step forward in our growth and innovation. With the opening of the new wing, W Hospital introduced 12 advanced operating rooms, a dedicated pediatric ward, and the 170-seat Songwon Hall Conference Center, while also creating a more comfortable environment for patients, families, and staff. The expansion added 141 general beds and 22 intensive care beds to our existing 299, bringing our total capacity to 462 beds. In May 2025, W Hospital was honored as the only private general hospital in the Yeongnam region, selected as an official medical partner for the APEC Summit. Among only 7 medical teams nationwide, our specialists were formally appointed to represent Korea in the field of severe trauma care, once again affirming W Hospital's national stature and capability. The medical staff of W Hospital continue to advance research through numerous publications and textbook contributions. In 2020, our article "Practical Tips for Successful Upper Extremity Replantation" received the Best Paper of the Year award from the American Society of Plastic Surgeons. More recently, our surgeons were selected as authors for the 9th edition of Green's Operative Hand Surgery, the world's leading textbook in hand surgery. In addition, we have been invited to contribute chapters on microsurgical replantation and congenital hand anomalies for other international surgical textbooks. Today, W Hospital brings together more than 50 specialized physicians across hand surgery, orthopedics, plastic surgery, pediatrics, neurosurgery, neurology, anesthesiology, internal medicine, general surgery, radiology, emergency medicine, pathology, obstetrics, and gynecology, dentistry, psychiatry, and more, delivering the highest standard of care. We also operate dedicated specialty centers, including the Congenital Difference Center, Hand and Microsurgery Reconstruction Center, Orthopedic Trauma and Joint Center, Shoulder Center, Foot and Ankle Center, and Spine Center, guided by the spirit of Oki Ilhae, which means treating each encounter with a patient as if it were our last opportunity to provide care. The dedication of our doctors and staff has allowed W Hospital to grow into a national leader and flagship of Korean healthcare. Looking ahead, W Hospital is determined not only to shape the next decade, but to lead the next 100 years of excellence in patient care and medical research to the world. A hospital of hope, healing, and history.